same way. And I hope everyone had a nice summer, had a chance to chat with you all, and great to hear the excellent stories, and I have some inspiration for my summer activities next summer. So thank you all again. We want to make sure we get rolling because Rachel, and Dustin have prepared a very nice agenda, and we want to respect everyone's time. And on that note, we welcome Dustin, of course, Dustin Manhart, our new AAA chair. And Dustin will be, I'm sure Rachel will be giving a more formal introduction. We are using this bike here because we have the AC is on the fritz, and we're going to be using this. So I promise not to hog the whole thing. But anyway, so Rachel, anything else? And
yes, we have two things in public comment. Well, good morning, everyone. Just a reminder that this meeting is being recorded for our public records and will be posted on the Arlington County Commission Meetings YouTube page. So just be sure to avoid sharing any personal information that you would not like to be made public. And with that, we have the opportunity for public comment. This is offered at the beginning of every meeting. Everyone is limited to 2 minutes, and so I know that we had a request for public comment in advance. So, Mr. Desai, we recognize you for 2 minutes.
Thank you. I am not able to see you. Can you hear me? Hello?
Mr. Desai, hold on just a moment. We're going to turn up the volume, sir.
Yeah, can you...
You say something again, please?
Yes, can you hear me?
we can hear you, but we're working on it.
Okay, all right.
If it's coming through the owl, it's fine.
It's coming through the owl, right?
Yeah, it is.
Using the owl, there's a volume control.
Oh, we can bring it. Can we bring it closer?
Please.
Mr. Desai, can you please speak?
Yes, okay. I'll try. My name is Nikhil Desai. I am 71 years old. I've had a disabled parking record for over 10 years. I live in a senior housing community, and I have had conflicts and harassment, from my landlord. But that apart, I have two questions. One is, should the county mandate a minimum set aside for disabled residents parking over and above the handicap spots, which require more space and cannot be limited to residents on such publicly supported communities? And the other is an arbitrary revocation of a disabled resident's parking pass, effectively limiting their participation in the world and putting their lives at risk if they were to cross streets with a walker or a wheelchair. Is that a problem?
All right. Well, thank you, Mr. Desai. We cannot provide legal advice on that, but that's something that we appreciate your comment on.
Yep.
Thank you, Mr. Desai.
Thank you. The only suggestion I had was that the county consider more handicap spots right outside buildings like these.
And that might be something for transportation.
Yeah.
All right. Thank you, sir.
Thank you, sir.
All right.
Do we have any other public comments? All right. Seeing none, we are going to proceed to the next.
Bonnie raised her hand.
Okay. Hey, Bonnie. Recognizing you.
Thank you. Good morning. I'm Bonnie O'Leary from the Northern Virginia Resource Center for Deaf and Hard of Hearing Persons. And I just want to let you know, those of you who perhaps don't know, that on Saturday, September 27th, which is coming up soon, we have our annual free outreach event, Celebrate Communication, at the Springfield Town Center. And we bring together at this event all kinds of resources for deafness and hearing loss. We had some of our Arlington friends stop by last year. I'm going to send the flyer to Rachel and maybe William to share it with everybody, but we will have audiologists. We will have the American Tinnitus Association for the first time ever is coming to this event. WMATA will be there to help people get tickets at a discount if you have a disability. If you're hard of hearing, bring your audiogram. We'll have cute speech exhibit, the state technology assistance program there, social groups for people who are deaf. We have our deaf crafters. We're going to have a live captioner. We're going to have so much wonderful stuff all in one place. So that's from 10 a.m. to 3 p.m. at the Springfield Town Center on Saturday, September 27th. And you know, hearing loss affects a lot of people who are older. So I wanted everybody to be aware of it. Thank you.
All right, thank you, Bonnie. Always great to hear from you. So it's September 27, 10 to 3. September 27, 10 to 3. Great to hear from you, Bonnie. Thank
Right.
you.
Right. Thank you.
All right. So without further ado, we have Erin and Mahi from the Center for Optimal Aging, and we look forward to your comments. Slide flip.
No. It's sorry, it's the remote. It's just, yeah, I'm on that. So, I think Rachel can do that for you.
Okay.
Sorry about that.
Sure.
Do we have?
I think we do up front. It's the keyboard.
Let me see if we can get you.
I guess we can
Get started.
Please.
Yeah.
Thank you all so much for having us today. My name is Mahadir Mardani. I'm a research assistant with the Center for Optimal Aging. I'm here with my colleagues, Ms. Erin Staker, who's our research coordinator, and Dr. Uma Kellikar, who's our senior research fellow. We also have our executive director, Dr. Patricia Heim, who will be joining us. It's lovely to be here, and I'm excited to tell you a little bit about the center and all the programs that we have.
Second.
We are from Marymount University, which is a minority majority serving institution with 25% of our undergraduate students being Hispanic. We also have our Saints for Service, which aims to provide resources and community engagement. And we also have a lot of community partners that we're also involved with.
Well, while we're getting the slide set up, I can tell you guys a little bit more about the center. So Marymount Center for Optimal Aging was founded in 2021, I think, 2022. So it's only a couple of years old. And the center is really a hub for a lot of things going on at Marymount. One is to expand its research. So this hub, we're looking a lot at what educational opportunities can we provide for older adults? What trainings and resources can we provide not only our faculty, but also our staff and also our students? So a lot of
this is also expanded on by our recent nomination as a Healthy 2030 People Champion by the General Surgeon, and our goal is to provide resources for older adults age and place. We have several community projects that are ongoing. One of them is our evidence-based loss prevention program that has been funded by the Administration for Community Living for the past 8 years. And we provided evidence-based loss prevention programs for over 10,000 older adults in the community. Additionally, we are also part of several health fairs and screenings throughout the year. We try to provide grip strength, BMI, and cognitive screening at various community events. We also have our virtual colloquiums, which are twice a year, and hopefully that's when we have our research work and we try to provide dissemination efforts for the community so they could be involved and have a great idea of the research work that we're doing. Additionally, we have our climate change and awareness. One of the things that older adults face is several risk factors due to climate change and the change in temperatures due to several comorbidities. So we want to have an awareness component to that as well. Additionally, we're always trying to advocate for more resources for older adults, which is why our MCOA affiliate, Dr. Sarah Papa, will be at the Capitol Hill briefing this Wednesday for the to unveil the National Falls Prevention Action Plan. And we also have our student chapter, which tries to engage students in geriatric workforce and show them that there are several avenues to be involved in aging research and work. So we want to highlight that as well. And we have several projects that are currently ongoing. One of them is on AI and cognition. Additionally, we also have oral health and cognition, caregivers. And our large longitudinal study, which Erin will go deeper into, is the Arlington Longitudinal Optimal Healthy Aging Study. I'll just give you a brief overview of some of the projects that we have, and then Erin will go deeper into the Aloha study. So our AI and cognition component is led by Dr. Catherine Diaz-Asper, and the goal of the project is to have a cognitive screening tool utilizing the telephone and then utilizing AI to screen for changes in speech patterns to provide early detection measures. One thing we noticed is that several measurements do exist, but they're very expensive, invasive, and are not easily accessible by the general population. So our goal is to have this tool easily available and also in different languages. So we're applying for several grants to implement it in Spanish and also Amharic, which are the two current languages that our team members are aware of. And additionally, we have our caregiver study led by Dr. Shelley Akwaje, which is evaluating the mental health concerns for caregivers of older adults with Alzheimer's disease. And it's mostly focused on Hispanic and Latino caregivers. And our goal is, because most caregivers neglect their own health, we want to provide a toolkit for them to be more aware of their mental health and also have a way to actually address it, maybe provide focus groups and additional resources so they can be more in charge of their own health. And one other research we have led by Dr. Uma Kelekar is also our oral health component. There is a bidirectional relationship between oral health and cognition, and we want to evaluate whether it's vice versa or one leads to another. And we've seen that due to cognitive decline, there are several risk factors like periodontal diseases that are more prevalent, and we want to evaluate the risk factors. And overall, we're utilizing our Aloha study to do a deeper overview as well. All right, and I'll pass it off to Erin.
Thank you, Mahi. So as Mahi was saying, everything that we're doing at the Center for Optimal Aging through all different disciplines. Because as you all know, for older adults, it's not just one specialty that's going to cover everything that they need. So we're trying to take everyone from Marymount University and all their different disciplines and see how can we use all these expertise to try to fuel into one kind of over-encompassing study to really look at what is aging and what does aging look like, especially here in Arlington. So the Arlington Longitudinal Optimal Healthy Aging Study, which is a bit of a mouthful, but we refer to it as Aloha, is really looking at all of these aspects of aging and over time. So we're inviting individuals not only in Arlington, but from all over the Northern Virginia region to come visit our site to do different tests, to look at their cognition, at their physical health, at their quality of life, at their neighborhood, and see what's going on. And then one of the key aspects, which I'll just touch on now, is we give people a health passport. So this is a document that's including some of the results from their study and also including some recommendations. So we'll look at, well, maybe your muscle mass is a little less than it should be, as noted on some of this test. What are things that we can work on? Is it just strength training, circuit training, resistance training, something like that? So try to figure out what's going on and try to figure out what are small ways that we can help you work to get to where you want to be. Next slide, please. So this study came about through Dr. Patricia Hine, who is the director for the Center for Optimal Aging and also works in Vice President of Research at Marymount University. So this is a really wonderful study. We're very, very lucky to have her here as the idea and the brains behind it all. But it really has been, we've all talked a little bit about some early numbers we found, but really, like, why do we need Aloha, and especially why here in Arlington? And it is because, like we were saying, Arlington has been recognized as America's fittest city for the past 7 years. And this is through a fitness index that was determined by the Center for Disease Control and the American College of Sports Medicine. And next slide, please. So the American Fitness Index, like I said, it was developed in 2008. And each year they take all of these different indexes around the country, and they determine the top 100 cities. And they use this through some personal health indicators, but also community health. And community health is important. And Arlington is very strong in community health. And as we know, that community health really does impact health on a personal level. So next slide, please.
Oh, come on. What happened?
Couple more.
What happened?
Oh my gosh. That one.
Woo.
Yep.
Perfect. All right, so like I said, now we have Aloha. So this is a 4-visit model per year study that's done at our campus at Boston campus. And we, like I said, we're tracking participants' health over time. Each participant, they come in every year and we're kind of reviewing those results. So we're giving them these results and then they're going through the year coming back. So we can see what's working, what's not, what's changing, what's not, and then we can kind of modify it as we go along. So there's really a lot to learn about on the individual level, but also what can we do through the center as well. And a big part of this as well is resources. So a lot of what we're doing is connecting with where we want to be informed, and we also want to make sure that we're telling people what is going on in their neck of the woods, what resources are available for them, what different classes, what are different things that they haven't even explored yet. So really working with different organizations like yourselves are really helping us make sure that we know what we're giving out is correct. We're staying on top of everything. And really, I think that's kind of we're all functioning better. If we know what's going on and you guys know what's going on with us, then we're providing the correct information for the people that we're all trying to serve. So here's just a quick little overview about the different visits. Like I said, we do physical fitness testing, cognitive testing, and then provide people with their feedback via the health passport. The next slide, please. And we also use the 4M framework, which I think a lot of you are familiar with. So this framework is built into the study and everything that we do through the center. And we're really trying to see what matters to each participant that comes in. We're really looking at their mental health through subjectively. We ask what they think of their mental or their cognition versus also doing cognitive testing, mobility, and then also medication. We're tracking them over time. And then this is just a framework that has been driving everything in the study. And this just goes to show that our health is kind of fluid. It's not really the same even on a day-to-day basis. So really, this is just going to show that the more information we have, the better informed we are to make our own choices about ourselves are really going to it's going to impact our health. So all of these different levels are going to fluidly kind of come together and push us towards health promotion and being able to age in place. So one of the goals that through Aloha, and like we talked about, is how can we make Aloha or Arlington, how can we make Arlington a US healthy city model, especially for aging in place? So how can we make Arlington as a model for individuals to age in place? And then that can be something that is, made into a framework that can be taken to other cities. So this is something that, we could work together, try to create, and then even take it out to other places. So slide here. So we've been conducting the study for about 2 months. So we're in very early stages, but we've had some very, very promising results so far. We've had about 66 people express interest, and we've only had a couple of recruitment events. And what I actually wanted to point out that's significant is on chart C here, you can see there's a red spot called referral from current participant. So we are increasingly having people in the study that were referred just from someone else who said, oh, I love this study so much, I went and told someone else about it. And that is also including someone's doctor. Someone went and told their doctor, and then their doctor wanted to enroll in the study to see. So we're really excited about this early recruitment data. Next slide. And the last thing I just wanted to touch about, while we're really excited about everything that we've gotten so far from this early data, this is not, there's still so much to do. We live sorry, excuse me, a little under the weather, so my voice is a little, but we're getting through there. So in terms of outreach, there's still a lot to do to get to all Arlingtonians. So most people who have been able to come to our site now have been very fortunate. They've had the resources to know what's going on to come there. They've had transportation. They don't have other responsibilities, which means that they can come to our site during the work week. So that's not really encompassing of everyone. So we want to know what are the barriers that are inhibiting people from coming? What are the barriers that inhibiting people from figuring out about Aloha in the first place? So one of our big outreach efforts is we created this program where we take components of the main Aloha study, because we're kind of landlocked, and we're taking it out to different communities. So we actually, next slide, please. Yeah, we did just get a recent grant to do a little bit of outreach. And this is, like I said, to take this program and go out into the community and learn and tell people. So part of this is going to be an educational bit. So we will go out and tell people, this is what it's like. Yeah.
Yeah, like Erin mentioned, the goal of this funding is to actually provide a health screening component and a health education session of various senior centers in the community. And our goal would be to promote, educate, and then if people are interested, we provide a small transportation incentive for them to actually come to the study site. But one bad thing about it, and it's also good, is that we're limited in terms of like the funding agency, and we're programming targeting Prince William and Fairfax counties, which is a limiting factor. So hopefully we're hoping to grow and sort of expand on it as well. So like I mentioned, and additionally, one good thing about this grant is we're finally going to be able to offer the program in Spanish as well. So this has been a long goal of ours, and this funding has allowed us to hire a bilingual outreach coordinator and also expand our resources. And initially, when we submitted the Aloha project, we also always wanted it to be bilingual. So we had all the resources. We just needed the person to get it off the ground. So we're really excited about that as well. Yeah, and overall, we have objective measures, subjective measures, and we also have direct insights from the community. We have an advisory committee who's been pivotal in helping us frame the study, and they have been a part of all the things that we've been doing in terms of giving us feedback, providing resources, providing opportunities to discuss the project. Because before we launched the Aloha study, we've been doing a lot of presentations. Dr. Hine has been advocating for this study for such a long time. So then that we have it off the ground, it's been community informed, and we just want to make sure that our community gets the resources they need, and we're giving back to our community in a way that they find useful. And we want this to drive policy and resources. So, and this is just a link to see how people can get involved and sign up for the study, and we're always recruiting. So we'll be happy if anyone is interested. Thank you. Any questions?
Do we have any questions? Yeah, Audrey, please. Can we share the mic?
Is it something I can follow up with you, or can you give us a quick overview of what you do in this area or what you've been finding?
Yeah, I could give a little bit of an idea about overcommission.
Yeah, can you rephrase the question about how to?
Yeah, what are we doing?
Why don't we check?
Yes, so since this is like a very risk factor targeting approach, so once we identify those risk factors, so we give those recommendations to the person, like, it's choice, right? Everyone has the choice to take over those healthy lifestyle, start to do, control over your health if you want. But at least we feel like it is our duty to give the information. So what we do into the health passport, we tell them, well, here's the wellness spectrum, right? So probably you are here. So if you do those approaches, you might be able to bring your health to this side of the spectrum, which will then potentially prevent you to develop those conditions. So if you keep the mobility, it's going to prevent you potentially to fall, or maybe if you're going to fall, you're going to fall less. So it's not the idea of giving the control of health to the person, but for the person to get the right information to take control. Because we all receive the same information in the news, right? Well, eat healthy, healthy eating is good for the brain too. The brain and the heart are connected. But we are going to have different way of developing some of those risk factors. So this customization, personalization is a way to help the person to recognize, okay, here where I am, those are my risk factors, and those are the things I can do to work to decrease my risk factors, to avoid that. So now we're going to learn by doing this approach, can we really impact and have our participants age better, age in place? So that's what we're going to learn by collecting. So that's why the longitudinal component is so critical, because that's what we're going to learn. And we're going to keep sharing, and we're going to keep getting your feedback, because, it takes more than a village. It takes more than a city for us to really move our population to optimal health. So definitely, we're always going to be working with you.
Super.
Thank you, Dr. Hahn.
Yeah, looks like Bonnie has her hand raised.
Yes, I do.
Yeah.
Bonnie, go ahead and enroll in your minutes.
Okay. I'm very, very hard of hearing, and I'm using a captioning feature on my phone. You might have said this, I don't know, but hearing loss is huge in the aging community. So does your lab have hearing screenings? Is that part of the health screenings? And if not, what are your forms of access for people who want to come to the lab who have a profound hearing loss? How do you handle that?
Thank you, Bonnie. So right now, unfortunately, a full audio screening is not going to be part of the Aloha study. And that's because, well, first of this is an institutionally funded study. So we don't have we do have some equipment, but in terms of expenses, that would be an expensive equipment to purchase. But however, again, this is really early, so this is definitely something that we can take into consideration and potentially put into a future version of this study. However, I do know we do go, when we go to a lot of these health screening and a lot of health fairs where we do screenings, there are always auditory screenings going on. So when we're out in the community doing health fairs, we're doing some screenings that will go together with the screening. However, we are asking people questions about their hearing and things like that. So that is something that we're definitely taking into consideration. And, once we have someone who,
So we thought about that, and then we look into the cost. And this, since we are right now piloting and introducing this study, we don't have all the funds. So we decided probably something to add on, but definitely it's part of our medical history and intake of health. So we do ask about sensory, we do ask about if they have been treated, if they are accommodated, if they have any assisted technology device that they are using. And we also recommend them to bring to the site when they come to the site for the testing, in the way they are using the best equipment. We do have a very basic screening in terms that feedback question. So when we're doing the consent, we ask them to tell us back what they understood. The way is not only to see about cognitive status, but also if they were able to hear the study well, and then give the information back to us. And then if there is a question, we talk to the person and then we ask them to talk to the doctor, make sure they're gonna have some hearing device when they come, because if not, it's cohesion. We are not even able to do the study in individuals that they don't understand the study. So that's number one, in our consent, we do that. We do that analog visual testing to make sure like they are able to see what we show them as well, for the same reason, because we want them to come to the site being able to see. So we ask them to bring their glasses or whatever technology they are using to help them to do those testing. And at this point, that's what we're doing, but definitely we want to learn more and then hopefully get more funding and support that we can add more expertise into the area and the equipment needed.
Thank you, Dr. Hine. We're going to take one more question. That's from Roland.
Thank you. And thank you for the presentation. I find it very, very interesting. Several years ago, Arlington did a health equity study, and they actually concluded that there were certain areas of the county that there was a huge discrepancy, and it was more by zip code. I'm wondering, is there any desire, do you plan on actually looking at that as well, the discrepancies, and maybe targeting people in those areas?
Yeah. Just those two. Yeah.
That's a great question, and that's actually what we're trying to do with this outreach grant that we got. So with this grant, it actually targets certain zip codes in Prince William and Fairfax counties that are medically designated underserved populations. So with this grant, we'll be going to different organizations in these different zip codes that are yes. So what we learn from this, we'll be able to transfer back to take it to Arlington. So we're learning what it's going to be like to go out into these communities. And then everything we're learning from that, we're going to take it back here and continue to spread it out. So yeah, we're learning how to do that, and then we're gonna pull it out here.
Super. We have two more questions from the audience.
Thank you, everyone, for your patience. Here we go.
Thank you. Very interested in your study, especially having a mom who's 100 years old. So,
All right.
just turned 100. I just wanted to suggest, and maybe you've already done it and I haven't noticed it. We have some wonderful senior centers in Arlington, which would be a great place to post the information. And also, if you go to Central Library with a flyer, they will make copies and put them out at all the libraries. It's a great way to get the word out because a lot of seniors do spend time at the library. So thank you. I'm interested in finding out more.
We have one more.
Hi, I'm Cheryl Beversdorf with Aging Matters. I know Patricia. I guess I'd be curious to know how the center determines what the priorities are. Is there some kind of a governing body that provides assistance or expertise? And after the Aloha study, perhaps is something else going to be coming up? And how do you choose what your priorities are for the center for the long term?
Thank you so much. That's a great question. So when I was recruited, a priority was like to build a connection with the university in terms of serving older adults with Arlington. And that's how was this conversation about what can we do with, current Marymount resources that we can serve our community. And so that's how we arrived with the Aloha study. That was like something that we can do, that was doable for us to start and now to grow. In terms of priority, we are always listening with our colleagues. Erin is very involved with many of the boards. I'm part of the board, so we keep following whatever is the current like public health needs and identification. So we know like falls is an area that we have been quite successful and doing for so long. So we're going to keep working on that. We are really a model for falls. We are always called like New York and several other places. Sarah, our group has to travel to do some modeling and training because we develop a good program in terms of deployment of falls prevention into the community. So we're still going to keep working and supporting that. And brain health is the second area that we're going to keep working. So mobility and brain, which my research always shows that is so connected. So my previous research shows that if you walk faster, you think faster. So it makes sense to keep their mobility and keep their brain connected and working their two paths.
And let's give a round of applause to optimal aging. Thank you all. It's a great group. I'll share two more comments in my.
Thank you, Dustin. You're a great MC. So, and we do thank the Center for Optimal Aging, and I'm sure you have updates either on your website, or if you have updates you send by email to us, please send to Dustin, Rachel, or myself, and we will share that. So thank you all again. All right, we're going to move on to the next item on our agenda, approval of the July minutes. Do we have a motion to approve?
I just had a few
Yeah,
changes.
Kathy.
The names were, I think, in the wrong place. Catalina and Karen are listed as guests and they're commissioners.
Sure.
And then the vice chair, there's another Casey who's listed as vice chair.
Yeah.
So just a couple corrections.
Yeah, send them directly to Justin and
Okay,
Dustin
well, I
and
can send this to you.
Rachel.
Okay,
Sorry.
thanks, Ann.
Subject to those corrections, let's hear a vote. All in favor of approving the minutes? Any opposed? All right, the meetings are approved. So next item is the staff reports, and so Dustin and Rachel, take it away.
Thank you. And thank you again for that presentation. I did just want to add as well that Kate Kramer with the fire department is planning to share that with the fire department's community risk reduction team. So thank you. But I will hand it over to Dustin, the new director of the Arlington Commission on Aging. Oh my goodness, just got promoted. The new director of the Agency on Aging, to start with some staff updates.
Welcome, Dustin.
Thank you, everyone. Hey, I just wanted to just quickly say thank you to the Center for Optimal Aging. I got to have the opportunity to see them present at the Virginia Governors Conference and to see them actually start the project. I actually did a tour of their facility very recently. I encourage you to check it out if you haven't had a chance. It's a great group, a great team, and they're doing a lot of stuff, and they really truly care about Arlington. They really are embedded in many of the committees in the community, and they really, really care. So they're great partners. Thank you all for coming today. Okay, so welcome to myself, I guess. It's great to be here. I see several of my team members that are actually in the audience as well. It's great to see them all here. I have a background in aging. I worked in Southern California, led a Meals on Wheels case management program for a number of years, was a case manager, have a master's of social work with a focus on older adults and families. So just really excited to be re-engaged in this community here in Arlington, here in the local community. And I've been in the DMV for the last decade, formerly worked at USAID as a Fed. So just really excited to be here and working with all of you. It's a great group, and it's been a great welcome so far. So let me jump into a few staffing updates. So for the ADRC, just want to highlight that for our information and referral center, and again, a couple of our staff are here, we do have a vacant position that we're filling. We're in the process of filling. The staff is working very hard on that. I really want to just acknowledge the team's really hard work. They've been, understaffed for quite some time, yet they've continued to step up to the plate. We've had an increase in numbers, increase of calls, increase of number of people that have come in, and they continue to rise to the occasion to support our residents here in Arlington. And it's really amazing to see. They're a great group. I also just want to point out that, our staff are challenged with a changing lower resource environment, and they have to work with our clients. They have to be the ones that tell them about other resources, sometimes have to tell them no or work with them to make sure they get what they need. So I just really want to recognize them for that. As an extension to that, emergency financial assistance, probably many of you are aware, the County of Arlington is an amazing place and really comes through for its residents and helps out in situations where somebody may be, have an eviction notice, they may not be able to pay for their utilities, and the county's done a wonderful job of that. Unfortunately, we've had to make some changes to that. We've had to lower that cap to $3,000 per month. That used to be higher. I think it's gone up and down. Per year, sorry, not per month, per year. Yeah, that'd be a lot. Wow. I also want to say that we also have a monthly cap now. So when the funds run out for the month, we can no longer provide anything. That the individual has to wait till next month. And in September, that cap ran out on the 5th. So in this month, literally in the first 5 days, it ran out. So just to give you an idea of where we are at right now in terms of resources and how things are working. So again, just really want to recognize our staff are the ones that have continued to work with our residents to try to meet their needs. The next thing I want to just quickly talk about, the Senior Farmers Market, one of our favorite programs. It is still alive and functioning. That's a $50 max per individual. Eligibility are Arlingtonians who are 60 plus with a monthly income of $2,413. If you're in a that's a one-person household. A two-person household would be $3,261. If you have any questions on that, please call us. We'll get you set up. There have been a few changes from the state level on that one, so they've kind of modernized the system. So there's been a few hiccups with that, but overall, a lot of really positive changes, and that program continues to go. And then the next one, just want to say thank you to the Commission on Aging, my colleagues here. I want to say thank you for the warm welcome. I've had a chance to meet some of you and interact with some of you and support some of your meetings. Wanted to let you all know that it is my intent to make it to all the committee meetings at some point, to check in, to be there with all the different things going on with work and things like that. I haven't made it to them all, but I just really want to thank you all for the great work that you do and for volunteering and being with us over the years and in the future years. And that's all I have.
Thank you. Well, thank you, Dustin. We are just so excited to welcome Dustin to the Arlington Agency on Aging, the Aging and Disability Services. And thank you all. I guess I have to sit down. But we are using the microphone for those of you in this room. The AC is broken, so hopefully everybody's staying pretty cool. And when William and I stand up, we get the air blowing, so little Beyonce effect there. But again, just really excited to welcome Dustin. He's been here, I think, about 6 weeks and has truly hit the ground running. So we're really excited to welcome him, to continue to onboard him. But we've had a lot of changes within our Community Supports and Coordination Bureau. I'm also thrilled to welcome Joanna Squires, who's here with us. She is the new guardianship coordinator within Adult Services. And this group, the Commission on Aging, particularly Erica Wood, has helped to advocate for this position. We have over 450 individuals who are under guardianship in Arlington County. And so really excited to welcome Joanna to the team. We also welcomed Anaries Morabel to the Adult Day program, and then Ricky Blanco to our Nursing Case Management program. So we have some existing vacancies, but we're slowly filling those positions, and really excited to welcome our new team members. Just a reminder, and we'll send something out after the meeting. As part of the county's AI policy, we are not permitted as of now to use AI in meetings. So just a caveat that if you are in one of the commission meetings, please don't use AI. We're hoping and advocating that can change, but like Read AI, Otter, we're not currently able to use per the county's AI policy. But if that changes, we will share updates. So before Helen retired, and as Dustin's been onboarding, we are in the throes of our area plan with the state. This is how local agencies on aging contract with the state. It's how we say we're going to spend our federal allocations, our state allocations. And we receive feedback from the community through our community engagement forum. At the June meeting, we had we kicked off a public comment session, but we submitted the first contract to the state. Dustin and I are currently working on part 2, which focuses on emergency preparedness and planning, and how as a county we take into account the needs for older adults. So we as a county have been doing a great job. I want to thank Kate, our Department of Public Safety, Communications and Emergency Management, our Red Cross. For the past few years, we have hosted events every September around emergency planning. We did share a flyer with the agenda. We are hosting an emergency preparedness workshop for caregivers at the end of this month. We'll be at the Walter Reed Community Center, and Jessica, thank you so much for the partnership, and Jennifer we're partnering with the 55+ programs to host that event. But a few things from the area plan, the public comment that I just wanted to raise and kind of elevate that were listed. We had 15 individuals complete the public comment who provided some comments. A few of the things that are probably no surprise to this group: unmet needs really focused around affordable housing options as they relate to across the spectrum, from independent living, assisted living, specifically affordable assisted living, as well as other long-term care options. A few other things that were kind of interesting were around sufficient parking, as well as public transit options. And we know Catalina and her group, her committee, have really been working hard to address and elevate some of those issues. Something that we found really interesting was restaurants that cater to younger demographics. And what was mentioned in that is the terms of food and menu options, but also only having sort of high top bar seating. So maybe something we can think about in terms of creative partnerships with the community and making our restaurants more age friendly. More benches across long sidewalks for people who need breaks, and then food security was a focus as well. For some of the recommendations to the AAA, we heard, again, housing affordability, lowering property taxes, prioritizing the needs of residents over developers, increasing funding for Meals on Wheels, and offering affordable assisted living as well as residential repair programs. So we'll provide a copy of some of the feedback that we did receive. But again, some of the themes that were lifted are no surprise to this group. And I know that many of the committees are working on these issues as well. And then the last thing I wanted to note here is you may all have seen that the Virginia Department of Health did ease access to COVID-19 vaccines. We know that this is something that is impacting our long-term care communities as well as our community at large, but did want to share that update from the Virginia Department of Health. And before I hand it over to Maimuna, I do want to give it to Michelle Thomas for a very special recognition.
Thank you so much, and it's always a pleasure to see everyone here at the Commission on Aging meetings. I wanted to use this opportunity to say hi to Michael Schuster. Michael Schuster has been with the Arlington VICAP program for 2 years. And Michael has now rolled off, but I wanted to publicly acknowledge you for the great work that you've done. Michael has litigated at the local and the state level. And while he has, contributed so many thoughts and ideas, Michael, I'm impressed with your vast knowledge, but I'm more impressed with your passion to serve the community. You are a true advocate at heart. And although, again, you rolled off of the Arlington VICAP as a volunteer, we continue to still work together through InVan. And we share the heart of advocacy. So thank you so much for all you've done. I appreciate you so much, and I look forward to continue to connecting.
Let me know when you're ready.
I'm coming, Mom, sorry. Go ahead. You can start.
Okay. Good morning, everyone. It's good to see you. I hope that you enjoyed your summer break. It's good to be back, and I was extremely excited to have you all meet Dustin. We have really enjoyed orienting him and getting him acclimated. Great fit for us in the AAA. So thank you, Rachel. Thank you, Dustin. And thank you to the AAA team members. I just wanted to make a few announcements. This is more on our department and county level. And so you may already know, but I'll go ahead and announce we do have a new legislative and policy analyst in the county manager's office.
Brian Etsy, who started just last week on September 8th. And I know that this commission is gearing up for the General Assembly, and we'll want to meet with Brian at some point. But his role is to look at, of course, the legislative priorities in the county. And he does have a background with Delegate Alfonso Lopez. So some of you may already be familiar with him. Also want to note that we will be welcoming a new medical director for our public health department, and will be the successor to Dr. Ruben Varghese. Her name is Dr. Deidre Parrish, Parrish, and she will begin on September 29th. She did work just like Dustin from USAID. And she was the medical officer there and focused primarily on HIV and AIDS in Asia. And she also was a regional medical director for the Department of Tennessee Public Health. And she is a board certified in infectious diseases, preventative medicine, and internal medicine. And then finally, you may recall Kurt Larrick, who retired in the springtime. And Kurt will be replaced by Destiny Esper, who also will begin this month. And she is going to be the Director of Communications. Esper is spelled E-S-P-E-R. And she was formerly employed with Arlington Economic Development as the Marketing and Communications Manager. So we do have some new folks on the director side that are reporting to Anita Freeman. Just wanted to announce that. And then I wanted to acknowledge Arlington Neighborhood Village, Wendy Zanker, your impact of 2024, your 10-year impact was incredible. You are a close partner to our work, and just want to publicly thank you and the Arlington Neighborhood Village, the volunteers, the strength of your organization, the outreach. I was very impressed to see that over 10 years, you have grown even the scholarships. Over 100% have grown the scholarships to ensure that low-income individuals can access Arlington Neighborhood Village's wonderful services, array of services. So I'm grateful to have Arlington Neighborhood Village thrive and be a very close partner. We definitely refer and look forward to 10 more years and counting. So congratulations. It's been a wonderful journey and a collaboration under your leadership, Wendy. Thank you. And I'll turn it back over to William.
Thank you, Maimuna.
Thank you.
Yeah, thank you so much, Maimuna, Rachel, Dustin. So we have a great staff. We love working with you. So this is great. We appreciate everything you're doing. All right, so next is the chair's report and executive committee, recruitment updates, etc. So I just want to, well, I'm glad everyone had a great summer. I want to thank all the commissioners and committee chairs. At the end of the spring, asked the committees to come to propose 2 to 3 exciting things that they are excited to accomplish in their age-friendly Arlington plan goals to accomplish by the end of the year in December. So I was very pleased and to get all the proposals. They committees not only focus on things that are inspiring to them, but items that are most helpful in their expertise to older adults in Arlington. So I'm going to ask the committee chairs when they give their updates to talk about them briefly. Yeah, I found them to be very insightful, creative, and exciting. If I can also add, they put a lot of thought into them. And we want to make sure that you are set up for success. So on that note, I would just share two things. Obviously you want to plan for challenges, and two challenges that we have perennially are that we don't have enough people or we don't have enough time. So don't limit yourself just to the people on your committee. Reach out to myself, all the other commissioners that you see here. Reach out to your networks, reach out to anyone else you think would be helpful to you, and reach out to our great staff here. Each of your county liaisons to your committees, to Dustin, to Rachel, to Maimuna, because we want to see everyone cross the finish line. So let's do that. And second, not enough time. Yes, during the holidays and all our personal plans, there are going to be challenges, right? We can anticipate that. So think about which of your 2 or 3 projects that you can accomplish, in the quickest time. Perhaps think of as low-hanging fruit, if you will, and focus on those. Get those done in the first month, so that October and November you can focus on your second, and if you have a third goal, your third goal, so that in December you can declare victory and write your reports and cross the finish line. So really appreciate your planned goals. All right. So on that note, I'm not going to go over each of the committee's goals until when I introduce the committee's reports. But anything else on your side, Rachel?
I think just in addition, for the Commission on Aging, there are currently 3 vacancies. We have received one application thus far, but please continue to share with your networks, anyone who may be interested in a strong advocate. And then with that, we also have elections for the Commission on Aging. We did call for nominees at the June meeting, and fortunately, our beloved chair, William Way, is willing to serve for another term, and Kathy Cameron is willing to serve as vice chair. Both are unopposed, but if anyone would like to submit their names right now, you have the opportunity to do so. So with that, we can vote for them as a slate. Is there a motion for William to continue on as chair and Kathy to serve as vice chair? Thank you, Roland. Is there a second? I've got Audrey. All right. All in favor, please raise your hand or say aye. Any opposed? No oppositions. So congratulations, chair and vice chair.
Thank you, Rachel, and thank you to the members of the commission. Kathy and I appreciate your vote of confidence and look forward to working with you for another exciting year. So thank you so much. Okay, so with that, we have our committee and work group updates. So it looks like housing is up first, so I will read their goals. So thank you, Audrey, and your colleague, Michael. He may be online, I'm not sure. So the first, and please feel free to comment on these and on these 2 goals. First is regarding the homeless. Meet with homeless shelter and supportive housing staff to learn more about the needs and how we might help. And by year end, make 2 such visits. And the second goal is regarding universal design. Give presentations to civic associations and add home safety information and resources in the Ambassador's Handbook, and that's the A&V Ambassador's Handbook, to promote existing universal design resources. So Audrey, would you like to provide any comments on those notes?
Thanks, William. And thank you, William, for narrowing down our goals for the year. We had started with something much more ambitious, and maybe we'll get there, but at least we won't get dinged if we don't. I just want to add that with the civic associations, I'm hoping Erica, sitting behind the column, will help me go to civic associations and talk about living safely at home. And we've got some resources and some funding options for repairs and grab bars and that kind of thing. If they're successful, I might have more of you to put me in touch with your civic associations. That seems to be a good way, if it's successful and they're interested, to do that. I like the comment that Marymount talked about getting flyers out to the public through the library system. So I'm going to look at that for our resources flyers. That might be great. And I also want to give an update on the ordinance, the Affordable Housing Ordinance Working Group, which had its last official meeting, I don't know, Thursday night. We've changed strategies along the way, and instead of going to the state with a specific percentage or dollar value or number of units they want to have, they've decided to go to the state and ask, or county board first, and then the state, to ask for permission to be able to change those things as needed, rather than have to go back each time. There is no plan B at this point, so we don't know what that's going to look like for developers or for the county at this point. If this goes through, March, beginning of next year, there will be a multi-sector working group like there was 20 years ago, whenever it was. So that the developers have more of a say and they don't want to sue us later. And we're hoping that'll go forward. That will really make a difference. Thank you.
Thank you, Audrey. And regarding civic associations and anything else, please feel free to reach out. I am always willing to attend and be a part of the entourage, and also to talk. Being a lawyer, they pay me to talk, so I'm glad to talk. So next is health and wellness, and Kasia and Kate has sent 3 goals, and I invite them to chat. First is regarding underserved communities. Connect with clergy to provide information and contacts on wellness programs such as dementia education and nutrition presentations focusing on underserved communities. And the name for underserved communities across Arlington. Second is with respect to hospital discharges. Create a reference chart for patients to help them care for themselves when they leave the hospital. And this will be done in coordination with VHC. And third is with respect to age-friendly health systems model. So meet with VHC, Director of Case Management, to encourage adoption of age-friendly health systems model. So I'm going to hand it over to Kasia. There you go. She's ready.
Good morning, everybody. So yes, those were the 3 goals that we felt probably would be most accomplishable by December. We've already initiated our first contact, which was with Macedonia Baptist Church, and we have connected them with the reference to resources. And we feel that it's necessary that we reach out to other community partners, especially in the underserved communities like Green Valley, Knock, Barbrook, and Columbia Forest, and make sure that they are aware of the resources that are available to their members there. I am meeting with the director of case management on Thursday to initiate the process of understanding the discharge process and how do they determine who is going to get what services once they are discharged, and hopefully take that information and just create an easy to follow 1-page resource document so that people in the community understand what's all involved, because as many of us know, the frustration for someone that, like for myself, being in the medical field, I understand, but I also have the frustration of trying to navigate the system. So I can only imagine a layperson and the frustration that they feel, especially if they end up back in the hospital over and over. And then also along those lines, at that same time, be talking with her to see where the hospital is on their age-friendly health systems model. They came and spoke with us earlier in the year, and they gave us some information about things that they are doing to meet the CMS requirements. So we're just going to follow up on that on Thursday.
Thank you, Kasia. We have a comment.
I
Yes.
just want to make sure you know about the Arlington Interfaith Network. The Arlington Interfaith Network. You want to make sure you're connected to that. Because it's a fast way to get to all of the faith institutions.
Yep, thank you, Wendy. So, yes, and so Kasia, appreciate it, and Kasia and Kate, it just shows us the richness of the expertise that we have on the commission. And using the networks. Yeah, we do see Maimuna's hand up, so Maimuna, you're next.
Yep.
I'm
One
so
second,
sorry.
Maimuna.
Oh. I am so sorry.
Good, Maimuna, you're up.
I'm so sorry. I will limit my questions and comments. I just wanted to mention, Kasia, you may be aware, but this Saturday, I do believe Green Valley is having a health and wellness fair. And so I know this is one of your goals to, make more connections. And I just want to make sure you're aware of that. We will have a table there. And then also VHC, I would love to connect with you because we do also want to improve and enhance care coordination. And so I have some ideas and thoughts. So I'm so glad that that's one of your goals. Thank you.
Thank you, Maimuna. All right, Kathy wants to add on. There you go, Kathy.
Yeah, thank you. I just wanted to thank Erin for presenting to the Health and Wellness Committee on Thursday last week. And we kind of took a deeper dive into the Aloha study as well as the work around a presentation she did around the invisible Arlingtonians, which addresses underserved communities. And it was a great conversation, I think, that we had because the data that you're collecting, I think, can show kind of what's working, what Arlington County services are addressing needs, but also how to identify gaps in services. And we as a commission can help in advocacy around maybe more funding for what works or trying to address some of the gaps in services. So I hope the relationship will definitely continue and maybe have you come back every year to talk about what you're learning. So that, we can help you as the commission, as advocates for older adults in the county. So thanks again for all the work that you do, your entire team.
All right, thank you, Kathy. Thank you, Maimuna. So yeah, so this, announcing our goals, this has elicited, comments and people jumping on to contribute. So that's what we want. And so really appreciate that. So next we have Roland on aging equity. So first has to do with AI. As our presenters have mentioned, AI could be a problem or a solution. And as we know, scams and fraud are on the rise, especially targeting older adults as well as everyone else, of course. So so the Aging Equity Committee plans to conduct a webinar on artificial intelligence, incorporating experts as well as those experts from law enforcement. That's their first goal. Second goal is on LGBTQ older adults. So presenting a panel on LGBTQ plus older adult issues in conjunction with LGBTQ plus working group of the Arlington Community Foundation. And third is we have a lot of presentations, but we need an archive. And so thank you, Roland, and your committee for doing this. Create an archive to make webinars and key information on elder fraud easily accessible to the community. And I know we've already started talking about this with Dustin and Rachel, so I am going to hand the mic over to Roland.
Thank you. We have started on at least two of the three goals that we have for the remainder of this year. In reference to the webinar on artificial intelligence, we're looking at trying to have something by the end of the year. However, we might have to get to another source for that information because VICAMP, which has been conducting the last two, this is the busiest part of the year for them coming up because it is the enrollment season. So unfortunately, they're going to be just swamped from October on. But they have, in this period of time, have already conducted a webinar because while we had our break during in the month of August, we had a seminar, a webinar, and it was on exploiting trust, exposing scams that impact older adults. And that was in August, on August 18th. And then a couple of days later, VICAMP and we also had attended, that is the commission and the committee, they had another seminar, which was on Medigap policies. And they were both pretty much well attended. Also, as part of our outreach effort during the month of August, we also participated in the county fair. So we also had the opportunity to, at least I did, share not only with the Department of Human Services, but also a table with the neighborhood village on behalf of the community ambassador program. That was actually very, very interesting to talk to people pretty much about that. But so far as the two remaining goals, the LGBTQ older issue panel, we're going to be working very closely with the Arlington Community Foundation pretty much on that. They already have an event scheduled. I'm trying to pull it up so that I can make sure that I get it right. The Arlington LGBTQ plus history tellers for Gay History Month, which is the month of October. So on the 16th of October, there's going to be a storytelling at the Lion Village Community Center. So if anyone is interested in that, please let me know because I'll send you the invitation for it. They have about 5 pretty good speakers who are going to be talking about Arlington during the 60s, during the 70s, during the 80s. And we even have, it even goes over to generation because they're going to end with an activist in the, who is pretty much in her, she's in her 20s, 30s. So they're going to end someone pretty much young. So it's going to go the whole span of activism in Arlington. Also, we are well on our way, I hope, to lay the foundation for an archive. What I have learned is that there is an incredible amount of information already on the Arlington website. The problem is putting it all in one place, and the problem is getting a search engine that works so that we can get access pretty much to all of the information. For anyone who's trying to get information on the website, I know that you have pretty much encountered some difficulties because it is a search engine I think pretty much needs to be looked at. For example, I noticed the other day when I was looking for things to bring up at the next committee meeting, which is on October 22nd, I just looked at VICAMP and they have a training academy on fraud. And you click on it and it gives you all of this information. You go through this training academy, then you know how to recognize fraud. Well, we've got to get that out to the community so that people know about it. So what the committee is going to be doing is we're going to be working with them. We also realize that 55 plus also has a series of webinars that they have done on fraud. And we want to be able to also be able to pull that so that people in Arlington, not just those at 55 plus, but anyone who wants to know about fraud can get access to it. I went on to Marymount site in anticipation of the meeting. They had an incredible source of information, pretty much the important stuff. So it's a matter of getting all of this together, and that's what we're going to be working on. I think that's something that's achievable. We did it. Arlington has done it before in the area of LGBTQ issues and stuff. So I think that's very, very not. It's going to be difficult because you're going to have, in a sense, because you're going to have to work with other departments and stuff at the county. But that's something that we pretty much, I think, going to have to start pretty much this year. Other than that, I think that's pretty much it.
Thank you, Roland.
Thank you, Roland. Much appreciated. I love the creative ideas and addressing key parts of the older adult community. So, the webinar, very, that would be a great resource. Doesn't have to be owned by Arlington or even by us, right? I mean, it could, the collection archive could be at Marymount. It could be at, sponsored by ANV or 55 Plus or Arlington Community Foundation. It could just be a bunch of links. So thank you. I think it's the art of the possible. What can we do? So thank you for that. And next we have transportation. And so I was pleased at all the work that transportation did over the summer. Had a chance to join my transportation colleagues at Hunters Park. We had 40 plus older adults at that residence, as well as 40 plus at what's the other one? Woodland Hill. Yes, that was great. And so transportation has been a model of outreach, if I may say, and it's great to work. And then the county staff has been very helpful and especially in addressing English learners and with language assistance. So it just goes to show the richness of the resources that we have in Arlington. So without, so I'm going to shut up and hand it over to Kathleen next time. Let's talk about the three goals that transportation has said. First, outreach. Conduct outreach visits to independent living residences in Arlington, meeting at least 100 residents where they are, listen to their transportation needs and concerns, and produce a memo with recommendations to the county board. The second concerns English learners and various communities in Arlington, because we have a rich array of communities in Arlington. So survey transportation needs of older adults in Arlington who speak multiple languages: Spanish, Vietnamese, Korean, Russian, Farsi, Amharic, Mandarin, Arabic, and I'm sure if there are other communities, transportation will be glad to add those. And gather at least 30 informal survey responses. I know they're far ahead in that respect. And the third is produce a draft transportation safety and accessibility guide for older adults that consolidates county resources and provides safety tips for pedestrians with different mobility needs. So Catalina.
Thank you. Just to add on to that, like Will mentioned, we've been doing a lot of outreach to the independent living residences. So we've gone to 2 so far. We have 3 more hopefully this year. We have Culpeper Garden on Wednesday. And if anyone is interested in joining, I'm happy to share the information. But thank you, Rachel, Dustin, and everyone for the support with especially the Korean translation that we'll have on Wednesday. I think the language access piece has been a big focus given the diversity of residents that we have in Arlington and the need to kind of reach the folks we might not always hear from. So that's happening, and we have like 16 of those informal surveys, we're calling them so far. So printed out on paper, some just high level questions about, what services do folks use with, check boxes for, ANV or Metro Access, things like that. And so that has been translated with the help of online tools into those languages that Will mentioned. So I have 16 of those in hand. again, hoping to get 30 and then hoping to summarize all of that outreach into some sort of a document with our learnings so that we can better advocate for older adults. And then on the other point, oh yes, for the safety and accessibility guide, there's been a lot of work over the late spring, summer, until now with the Disability Advisory Commission, the Pedestrian Advisory Committee, Transportation Commission to some extent, all sorts of groups, even including Walk Arlington, Vision Zero, to just think through some of the things that we've heard around poor conditions on sidewalks, falls related to that, like first mile, last mile challenges. And so there's a smaller subgroup now that's working to think through like how do we consolidate these resources and make them easy to understand for folks that have questions. So getting a draft of that is one of the goals that we'll mention. And I think part of that is looking at precedents in other communities around the area and in the country. And also part of that is working with Rachel and Dustin and Co. To think about how we might leverage the Community Engagement Forum next year as a platform to focus on transportation. And then we can, you know, maybe even broaden the scope a little bit to think about paratransit needs and everything like that. So a lot of work going on there. I'll also mention the transportation booklet. If I could squeeze that in as a goal, I do have that top of mind, Rachel. The transportation booklet, if you're not familiar with it, it's online. It's in English and Spanish right now, but it already does a great job consolidating a lot of the resources. Like Super Senior Taxi talks about like the eligibility criteria for Metro Access, but it probably could use a refresher. And that's a piece of material that we hand out at these engagements that we do, and it's like flies off the shelves. People really find it beneficial. So I'm hoping that we can work together to update that and also hopefully get it translated into more languages. And then as it pertains to some of the liaison activities, the advisory group for Arlington's Transportation Future met last week. Again, that's the group that has been working together now for about a year, but then we'll continue for another 6 months to try to work together on the updated master transportation plan for Arlington. So it has representatives from all of the different commissions and committees. And so they have requested some input from commissioners on this modal priority network. You'll have to bear with me because this meeting was fresh and it was fairly technical. But I put a map up for those in the room at that front entrance, and there are some sticky notes behind it, and I'm happy to stand by there as everyone filters out. But if there are certain like areas that you're familiar with, that routes that you normally take where you think there could be improvements, like north-south connections or east-west connections across the county, even if you don't have all the specifics, feel free to like just drop a sticky note there and say that, you know, you can use a bus here or some sort of connection because it takes an hour to get from where you need to go when it's only like 15 minutes by car, whatever it is, any input's helpful. They are working on trying to make the maps more accessible. I suggested before they do their true public outreach that they add, if possible, like a key for senior centers and independent living residences and those sorts of key places so that you can orient yourself to the map, because again, you'll see it, it's pretty in the weeds and technical. You'll see little line segments, but it's hard to tell the colors apart and could use some work. But anyway, that is one thing. And then the Vision Zero external stakeholders group is meeting for the first time in early October. So thanks again to the commissioners for filling out that short survey. They basically wanted us to think about what we've seen change since 2021 with the Vision Zero action plan and things like, you know, we should be thinking about as they refresh for the next 5 years. So more to come on that, but I think those are the key updates.
Yeah, thank you, Catalina, and the Transportation Committee for all the hard work. So at the engagements, Peggy was there, and I also saw Joan, Galare, and I hope I'm not missing anyone, but anyone else?
And yeah, thank you to the folks that joined from the Benefits Enrollment Center and the ADRC for your continued support.
Right, go team. There you go. Thank you. Yes, so transportation is important because some of us are lucky to live in Arlington. Others may not live in Arlington and they rely on transportation. So that's why transportation is so important. So it has a nexus to the housing question because if you don't live in Arlington, you need good transportation to get here. So thank you for working on that. So next is Charlie on long-term care residences. So really appreciate all the work that long-term care has been doing, and I've been privileged to work with Charlie and Maimuna on the Cherrydale Community Advisory Committee. So long-term care has, I want to share their 3 goals. First has to do with the small household model, as opposed to the large nursing homes. So prepare a report on how other states provide incentives for the small household model in order to seek state policy change. And the second goal has to do with the community advisory councils. Prepare a list of best practices for community advisory councils. And this is for nursing homes, assisted living, other independent living residences, all those. And also the committee notes that we have 3 community advisory councils so far. And the third item is regarding disclosure of, because we want to make sure that the residences get the best services that they can. So residents get the best services that they can. So their goal is to meet with the Virginia State Long-Term Care Ombudsperson to pursue limited disclosure of facility-specific long-term care ombudsman complaints. So, I only learned this recently. I'm always looking for volunteers to be long-term care ombudsman, but there's a LCC ombudsperson at each residence, and they circulate among the residents to try to solve any issues, concerns that residents have. And so the ombudsman's office obviously will have the pulse of complaints for each facility, and I think that that's what Charlie is driving at here. So I want to hand it over to Charlie.
Thank you, William. The first, each of these tasks that we've talked about relates to one of the main goals of our age-friendly plan dealing with long-term care. The first one, I'm preparing a report on state incentives for the small household model. Really goes to our goal of educating and advocating literally the world on the importance of changing our model of nursing home care from an institutional model to a small household model. And part of that task is that I've had the honor of working with the national coalition, or the Moving Forward Coalition, which has been dedicated to implementing recommendations of the National Academy of Sciences on nursing home quality. And one key part of that has been changing the brick and block design model of nursing homes. And as most of you, but perhaps not all of you know, the small household model is characterized by a number of elements, but I think among the top elements are the fact that living areas are no more than 12 to 15 people, sometimes up to 20, in an environment that looks and functions like a household with an open kitchen, private bedrooms and bathrooms. Almost nothing like that exists in Virginia, and it's still rare across the country, but there are some great models of it out there, most notably the Greenhouse Project. So the report that we're just about finished in the Moving Forward Coalition has looked at states that have taken some steps to incentivize or facilitate the small household model, and we hope to use that report to really ramp up our education and advocacy efforts locally and statewide. The second task about community advisory councils is somewhat of an expanded direction of our age-friendly plan, which was looking just at establishing them in nursing homes. But then we realized that we have a unique situation in Arlington. First of all, community advisory councils to long-term care facilities are a rare breed. And not only do we have one that William and I are involved in at Cherrydale Nursing Home, There's also a Community Advisory Council at Mary Marshall Assisted Living Facility and at the Carlin, an independent living facility. So we have all three levels of care with an example of a Community Advisory Council. So we've decided that why don't we take advantage of that and kind of bring together representatives from all three to talk about what makes it work well, what does success look like, what has been done with these councils to improve quality or to improve engagement. Are there common denominators? They're also very different communities and populations, so there are differences too. But we're just beginning to do that. And I've talked with, I just touched base with Audrey at the Carlin and Erica Wood at Mary Marshall. We hope to begin that process. And the third one about the ombudsman data, there's kind of a history of how the data disclosures have changed over the years. And we were hoping to be able to get more in-depth information. Joni Latimer is the state ombudsman. I've had some conversations with her, learned that it's actually a very complicated issue. And she has agreed to come to our November Long-Term Care Residences Committee meeting to discuss the issue. So we hope to have some clarity and resolution of what can be done, what can't be done by that. So I think all three of these tasks are things that I'm optimistic we can have some concrete results by the end of the year. Thank you.
Thank you so much, Charlie. Do we have any questions or comments to any of the committees based on what's been presented so far? All right, I don't see anything online either, so thank you all so much. I'm very impressed by the goals, very insightful, creative, and exciting, I would add, as we asked in the prompt, so to speak. So, we want to help. We're all here to work together as a team and have everyone across the finish line. So stay connected and keep communicating. All right, next we have our liaison updates. So I'm going to hand over to Rachel.
I think we'll start with Kathy for Age Friendly Arlington.
Thank you, Rachel, William. Just a quick update and kind of a request. I think as many of you know, AARP kind of serves as the national lead for the age-friendly states and communities. And we have received the annual survey for all of the communities and states that have been deemed age-friendly. So it's a pretty extensive survey. It's due next month, but a lot of it has to do with the impact of funding cuts to the work of age-friendly communities and states and what impact that's going to have moving forward. So I may need to reach out to you, Rachel, and Dustin, as well as the chairs of some of the committees to help complete this survey. So we'll see. And every year AARP does this survey to help them as the national support organization for assistance, development of resources, webinars, etc. But I also wanted to mention in their message for the survey, they announced that they now have 1,000 states and communities across the country that are deemed age-friendly. So we're part of this really exciting network that's trying to improve care and services to older adults across the country.
And next we have Michael Schuster with the Alexandria Commission on Aging.
Thank you, Rachel. And thank you, Michelle. I'm still part of the VICAP. It's just across the street in Alexandria. So we will we'll be interacting probably as much as we have in the past. But thank you for those kind words. Just a few things. Our commission met last Thursday. We meet at night. I prefer morning meetings, but under our charter, we have to meet at night. Anyway, just a few things. We also have a new legislative director, a protege of Congressman Conley and Congressman Rash. She's very good, and I'll try to connect her with Brian. In our last meeting, there's a few things that I think are pertinent to what we discussed today. we had a presentation from our health department on our community health assessment and our community health improvement plan. Do you have that in Arlington? Okay. What we were going to do, we're going to try to mesh our age-friendly plan with their plan as well as with the housing master plan. But what they found out using census tracts, there are 2 areas in Alexandria that really need special attention. So the next 5 years, they're going to spend a lot of the resources looking at Arlandria as well as a landmark area. And the overarching issue they're going to probably have for the city, instead of 5 different issues, it's going to be mental health and that whole continuum of dealing with mental health. They have a really good dashboard that shows you what census tracts has problems with dental care, insurance coverage, and that sort of thing. I can give you a link to that, but it's really helpful as a planning tool. And then an update on the purchase of the Elate. I mentioned at the last meeting that the Landry Senior High Raise is going to be closing temporarily and renovated. And they are now in the process of moving people from Ladre into the Elate. The Public Housing Authority in Alexandria did get money from the state, $50+ million a bond that was backstopped by the city. And so they have purchased that particular facility. And now we have access to, I think, up to 110 units, supportable units. So that's quite a big win for Alexandria. And we really, really needed it. And lastly, Dustin, Rachel, and Chris Moore, my boss, met last month talking about how we can try to improve collaboration between our two jurisdictions as well as our 2 commissions. That's it.
Thank you so much, Michael. And now we'll pivot to Jennifer Collins with 55+ updates.
Good morning, everyone. Just real quick, similar to Rachel, we've been in the hiring mode for the first time in the last year. All 5 of our 55+ centers now have center directors. The latest being Emily Ingram, hired at Aurora Hills. So if you're there, please stop and say hello to her. And our only open position, I always knock on wood when we say this now, just closed last week, was for the Walter Reed Social 60+ program coordinator. So hopefully we will be hiring for that in the next month. We're just waiting on all the wonderful candidate applications for sure we're going to get. And we are in full swing with fall programming. Last Friday, we hosted at Lover Run in partnership with Marymount, Falls Prevention, and Virginia Hospital. We had the Falls Prevention Safety Expo. And then, of course, we'll be doing the expo, or the emergency preparedness for caregivers at Walter Reed in a couple weeks. So looking forward to that. And our staff are just in full swing because today was their due date for all of our winter programs. So now we will start scheduling for spring. And the other thing I wanted to update you all up on is the Alliance for Arlington Senior Programs. You've probably been hearing they've been doing a lot of digital equity work. And ever since COVID, they brought through grants, they've brought programming to our senior center and to some of the affordable housing, where they've been doing like 6-week computer classes with instructors that they pay for and provide laptops to the participants. And they also just received a grant, another one from the New Digital Equity Coalition Group, and that was approved by the county board last Saturday. And they're going to be bringing, starting probably at the end of this month, it's going to be a fast turnaround, help desk, technology help desk to a couple of the senior centers and to some of the affordable housing. So more will be coming out on that very soon. And they're also working with Connected Nation, which was a group that came out last February and did free computer classes at Arlington Mill at the computer lab there. And it was 3 days of classes, 4 or 5 classes a day, all highly attended, 25, 30 people in each. They're offered in English and Spanish. And so we're going to be bringing those classes back the end of October. And this is just like still being finalized, but more information will be out on that very soon too. So stay tuned for all of their great work. Thank you.
And I think the only other update that we have, I don't know if Erica wants to add anything, but the Northern Virginia Aging Network, I'm going to go behind this so it doesn't blow my hair. The Northern Virginia Aging Network has the legislative breakfast coming up, but I do want to thank Erica and Karen, who have been doing an amazing job of compiling the Northern Virginia Aging Network legislative priorities, compiling those. The county board requested those much earlier than they have in the past. But Erica and Karen have been doing a great job of providing that and advocating on behalf of the Northern Virginia Aging Network and the commission.
Thank you, Rachel. So the Northern Virginia Aging Network legislative breakfast is coming up on October 3rd. I just wonder how many of you have been to the breakfast? Okay, that's a pretty good show. If you haven't been, it's an experience because we do get a big proportion of the Northern Virginia delegation, the legislators and the senators. And this is an opportunity to really interact with them as well as to see the unveiling of the Northern Virginia Network platform. It's a big event. We usually get about 180, 200 people. So I hope you can be there.
And the flyer for the legislative breakfast was shared with the agenda. But if you need additional information or Dustin or I to send it again, please let us know and we will.
And thank you to all our friends and partners who are here. Would anyone else like to add it? Cheryl, okay. Any other volunteers so that I don't miss you? And thank you so much for helping out. State your name. Sine. Thank you, Sine. Yep, appreciate your help at Woodland Hills. So, Cheryl.
I know a lot of you know me because you've either been on Aging Matters show or will be on Aging Matters show at some point in the podcast. And it just occurred to me, I haven't been at a meeting for quite a while, but listening to many of the committee reports here, and I just took a lot of notes, whether Roland talks about LGBTQ or Charlie talks about the long-term care ombudsman program, or Michelle talks about Medicare. I just wanted to put in a plug for Aging Matters. Some of you do not know, I've been around and been producing podcasts for, I'm in my 9th year. Village Movement, I was just looking at Wendy. And there's a lot of resources. And in fact, as I was listening to Roland talk about an archives, I don't have an archives right now, but I would love to get some assistance for Aging Matters so that it could be useful for the committees that are here, as well as the commission members as well. So I'd just love to put in a plug. And it's not only the podcasts. I've also done now coming up 52 television episodes. And so I'm always looking for new topics. In fact, looking at Patricia over there, this coming tomorrow, as a matter of fact, you're going to be producing a show about design and how design in houses helps older adults. And so there's just a lot of information. And if there was some way that I could ask Commission on Aging and work together to put together an archives so that you would have access to all of this information, because there's some really fabulous people who I've interviewed already beyond the experts here in this room. So I just put that out to, if there's some way that I could work with you. Thanks.
And of course, we have Brenda.
I'm Brenda Cox. I'm a former member of this commission long time ago. And I just wanted to share that I'm the coordinator of the Lomax Senior Ministry of the Lomax Amy Zion Church. And in October, our topic is going to be on VICAP and the open season for Medicare. And Michelle was going to be there, and she has very generously shared with or offered to come. We're going to have a presentation on Medicare that people need. It's very critical. But we're opening it up to the community rather than being at Lomax. We're going to be at Mount Olive Baptist Church. We're going to be sending a flyer out. It's going to be a broader community program. And in addition to the presentation, Michelle has very generously offered to have staff there so that people can have individual consultations after, and I've already confirmed this with Mount Olive with that. So please be on the lookout for the flyer and encourage people to come. We'll be sending it out. We did a falls prevention workshop with Marymount that was very successful. So we're using that model to reach out to the community and, hopefully we'll have a successful.
Thank you, Brenda. I know Joan has her hand up. So yes, thank you for those programs, and you're probably working with our healthcare committee already, but please share those invites with us so that we can also participate. I also see Link back here, so thank you, Link. Joan.
I have a question. I want to know what has happened to the ambassador program, which was a big project for this commission. And I don't know if Roland can tell me on equity or Wendy or the Marymount group. I just want to know what's happened to our ambassador program.
Thank you, Joan. Do we have any volunteers? Yes, Wendy will take the question, and anyone else is welcome to add on.
Thanks. I think you saw a lot of people smiling and ready to raise their hand to give the update. It is alive and well. As we've said before, I think we have at this point 30 ambassadors. We've created a second version of the handbook. So we had the first, which was beta. We knew we were going to learn from that. Second version was issued about 6 weeks ago with all updates and new programs added. The ambassadors are currently meeting as a group, I think every other month, and they have different experts coming in to brief them so that they can get a deeper dive understanding of the programs. And the 55 plus program is actually doing a presentation this coming Monday, I believe it is. So yes, the ambassador program is alive and well, updated handbook, 30 ambassadors, learning deeply on programs. But having said that, there's always something we're not doing. And what we're not doing yet is a great job getting out in the community. I mean, we have ambassadors, we have interested people, we're teaching them about the programs, but we also have to teach them how to do outreach. So these are really just sort of nice people who want to do more, but we've got to teach them how to be advocates and get meetings scheduled and go to civic associations, go to their churches, go to other locations to do more of the physical outreach that's needed. So that's the good, and there's still to be done.
Thank you, Wendy. Yes, do we want to add back on? Well, we can follow up with that one. Thank you for the suggestion, Joan. And regarding outreach, transportation has done so many outreach events, and other commissioners have jumped in on them. So Culpeper is next, and Catalina, mentioned the date. So, and there will be other residences, and yeah, it's and SNA was there. They're fun, they're great, and come out with us. Okay, Wendy wants a second round.
I just want to make a little advertisement. So everybody's talked about outreach. That's wonderful. You're talking about giving us flyers, but I want to also encourage you to give us text in a document and a URL registration. I'm getting lots of flyers that have a QR code on them. Well, when I want to take that information and put it into my newsletter that goes out to 700 people, we have to retype all that. We have to go to that QR code. We've got to find what invariably is a very long link and try to put that in the document. That puts a lot of extra work on us. And sometimes I just don't have the time to do it. So flyers are great. They're wonderful if you have a place to post them. But if you want us to take information and regurgitate it to our community, we need something we can work with. So just FYI.
And watch the fonts, because sometimes they're very difficult to read. And also I wanted to thank Jennifer and the Park and Recreation Department, because when we're talking about tops in the nation, Park and Rec is always in the top 5 in the country. So they really contribute to the quality of life here for everybody, and especially if we're adults. And also to AASP, as well as the Senior Advisory Council, and all the great work that they do. So thank you so much. Did we have any other friends and family who want to provide an update? Okay. I don't see any. And I don't see any online either. So, Rachel, do you have something? Go ahead.
I can just do two updates and then wanted to remind everyone, I know we had a long meeting, if you have an opportunity to stick around to say hi to Dustin, and then also Joanna as well. It's her first day today. And again, she's our guardianship coordinator. But I don't know if our friends from Culpeper Garden want to give any updates, but primarily our adult services team and our aging and disability resource team have been working with some of the residents at the Culpeper Garden Assisted Living. As we've mentioned and Marta presented at the July meeting, Culpeper Garden made the decision to close the assisted living. So those residents and caregivers are meeting with some of the Culpeper Garden staff, some of the staff that they brought in. We have a number of individuals who've been open to Arlington County's Aging and Disability Services programs, primarily our adult services program, as well as our senior adult mental health program. But as a result, Arlington's only really affordable assisted living that remains is Mary Marshall. Mary Marshall is at capacity, and it's for individuals who meet assisted living level of care, but also have a diagnosis of serious mental illness. So we're continuing to work with the residents. There's about 57, 56 who are still in assisted living who will need to transition out before the end of June. So Marta, I don't know if you want to add anything?
We did make the decision, and the board, who I'm sure everyone trusts and respects, with all the information they had, made the decision. It took a couple of years and many meetings to come to this point, but it was a fiduciary responsibility for the longevity of Culpeper Garden. And so on that note, we gave a year to look after our residents, support them, and make sure we're able to facilitate the optimal transition for each family, which we are doing. We have coming up, I think a week from Friday, caregivers to come and do a health fair to meet with families in terms of what they can offer. All the residents have a contract with HUD, so they are allowed to remain in their units. We have some concerns about some of those individuals remaining in their units. It's a very different dynamic to be in this independent living than assisted living. So we are doing our best to make sure we inform. We have just agreed to work with a psychologist who our Jerry Psych, Dr. Sales recommended, to meet with the residents, to do counseling as a group and one-on-one. So that is starting in October. And we continue to give them the best support we can while looking for the future of Culpeper Garden. There's some interesting models that are out there. I'm on the board of Leading Age Virginia, and within Leading Age affordable housing, there are a lot of places similar to Culpeper Garden that had subsidized assisted living that had to close due for the same thing, the financial impossibility of it. And so what they're doing is they're bringing wellness programs into their buildings to support the longevity of their independent living residents. So I have multiple meetings set up. Goodwin Living is coming. It's actually their division, Goodwin Health. And they're coming to look at some of the space that we'll have in our assisted living building that will now be independent living. Could we build out clinics? Could we build out a place for dementia care? Could we bring our Marymount partners in to support? And could this open up to the community? I've had a lot of nurse practitioners, doctors say they would be happy to rent space from us and provide care. So a quick scenario would be if I have a resident who has bronchitis or cold and they don't have the money to go to the doctor, and now it becomes pneumonia and it's a 911 call. And if they're there and there's no one to receive them when they come back, if they're impaired, that's a problem. So how can we avert that by having on-site care for psych, for health, PT? We've got PT companies. So we're looking to protect the folks we have and give them a longer time experience in independent living. And that
is the model that a lot of folks are doing nationwide. And I think it pulls Culpeper Garden ahead of a lot of folks, and especially for affordable. So that's what we're doing. It's been a difficult time, no question. We love our residents, and not all families have received this well, understandable, but we're doing the best we can. And that's the best we can do. We value our relationship with the county, and so we're hoping to go forward together to look after these individuals and then take this new model out, which I would love to share with you all going forward, because I think it's very, very innovative. So.
All right, last chance. Anyone else has updates that they want to share? Any other old business, new business announcements? Otherwise, the next meeting is Monday, the 20th of October, and it's a virtual meeting via Microsoft Teams. So thank you, everyone. Look forward to pushing you, pulling you, dragging you across the finish line, committee. So thank you so much, and hope you have a great day. Thanks for joining us today.
Thank you.
Thank you.
Recording that.